Hello, Mrs. Glock. My name is Mitchell. I'm a physician here. Can you please tell me why you're in here today?
Oh, I've got a really bad migraine.
Okay. Can you please show me where your migraine is and describe the pain for me?
I just got really bad, throbbing pain in between, right on both sides of my head, and the lights just make it, a lot worse.
Okay. Ms. Glock, can you please rate your pain for me? 0 being no pain at all, and 10 being the worst pain in your life?
It's gotta be at least a 10.
At least a 10. Okay. What I'm gonna go do is put an order in and have the nurse come in here to give you some Demerol. Are you have any kind of allergies to this medication before, or any kind of allergies to morphine or anything?
I don't have any allergies to any medications.
Okay. Well, I'm gonna go to the nurse and let her know, come in here and give you some of that Demerol, okay, to treat that acute migraine we're having.
All right, hurry, doctor, please.
All right,
It's
we'll be
just
right in.
killing me.
All right.
Oh, are you here for my shot?
Trade name Demerol, generic name mepridine hydrochloride, is classified as an opioid analgesic class 2 schedule. It's available in injection, syrup, or tablet. The action includes binding with opioid receptors in the central nervous system, altering perception of and emotional response to pain. Onset of action includes 10 to 15 minutes when given IM, peaking at 30 to 50 minutes and lasting 2 to 4 hours. Side effects include clouded sensorium, dizziness, euphoria, lightheadedness, sedation, somnolence, seizures, hallucinations, physical dependence, syncope, tremor, bradycardia, cardiac arrest, shock, hypotension, constipation, dry mouth, nausea, vomiting, urinary retention, and local tissue irritation. Nursing considerations include it may increase amylase and lipase levels, it may lead to a rare but serious decrease in adrenal gland cortisol production, increased risk for oversedation and respiratory depression if they snore or have a history of sleep apnea. Patient teaching includes can produce drug dependence of the morphine type and has a potential for abuse. Psychic dependence, physical dependence, and tolerance may develop. Overdose signs and symptoms include respiratory depression, somnolence, progressing to stupor, coma, bradycardia, hypotension, hypothermia, delirium, skeletal muscle flaccidity, circulatory collapse, and death. Do not use this medication in pregnant women before labor. Drug appears in breast milk. Patient should discontinue breastfeeding or discontinue drug. Cost ranges anywhere from $33.67 to $200.80.
How are you feeling after the Demerol that we gave you?
I feel a lot better,
Good. Can you please rate your pain again for me? 0 being no pain at all, and 10 being the worst pain in your life.
I'd say we're probably down to 4.
4. Perfect.
It's manageable. It's manageable.
Okay. After reviewing your chart, I did see you have been in our emergency room 3 times this week for migraines. I have a concern related to your home narcotic use, okay? I see you seem to be running out of your prescriptions sooner. You're losing, looks like you're losing your medications, you're losing your prescriptions. I believe there could be some misuse of your narcotics.
No, I can't help it. I need him. I need him, doctor. You can't, don't tell me you're taking him away. I need him.
I'm not taking them away, but what I'm going to do is refer you to a specialist, a pain specialist here. And then what I'm also going to do is talk to your primary care and just let them know what's going on. All right? What I'm going to do today is I'm going to give you a prescription for Imitrex. And then what I'm going to do is have the nurse come in here and give you some information and explain everything about that medication that we're going to be prescribing you today, okay?
All right.
All right, well, let me get the nurse, and she'll go over that medication with you, okay?
All right, thanks.
Trade name Imitrex, generic name sumatriptan succinate. It's available in PO, subcutaneous, nasal powder, or nasal solution. Classification is an anti-migraine or a triptan. The benefit to this drug is that it has a non-addictive personality. It acts as an agonist at serotonin receptors on extracerebral intracranial blood vessels, which constricts the affected vessels. It inhibits neuropeptide release and reduces pain transmission in the trigeminal pathways. When given orally, the onset of action is 30 minutes, with the peak being in 2 to 2.5 hours. Serious side effects may include atrial fibrillation, ventricular fibrillation, ventricular tachycardia, coronary artery vasospasm, transit myocardial ischemia, and myocardial infarction. Common side effects include dizziness, drowsiness, anxiety, fatigue, pressure or tightness in the chest, altered vision, abdominal discomfort, diarrhea, nausea, vomiting, muscle cramps, neck pain, and flushing. Nursing considerations include it may increase liver enzymes on lab studies. It's not recommended for patients who have a history of ischemic cardiac cerebral or peripheral vascular syndromes, Wolff-Parkinson syndrome, arrhythmias, uncontrolled hypertension, or hepatic impairment. When combining Imitrex with an SSRI antidepressant, it may cause serotonin syndrome manifested by restlessness, hallucinations, loss of coordination, fast heartbeat, and rapid changes in blood pressure, increased body temperature, hyperreflexia, nausea, vomiting, and diarrhea. Patient teaching includes Imitrex is used only to treat migraines. It is not used to prevent them. Store away from heat, light, and moisture. Do not store in the bathroom. Patient and family need to monitor for signs and symptoms of seizures. Follow-up care is a key part of your treatment and safety. Be sure to make and go to all appointments and call your doctor if you are having problems. The cost varies from $11.09 to $576.02.
泪泪小翠，是路朝朝，可看年岁，秋水迢迢。